Growth is an amazing thing. From the moment a child is born, they embark on a journey of growth and development. But sometimes, this journey can be affected by growth disorders. These conditions prevent normal growth. They can affect height, weight, and overall development. Imagine a child much shorter than their classmates or a teenager without a growth spurt. These are examples of growth disorders. Early detection and intervention help children reach their potential. There are many different types of growth disorders, each with its own set of characteristics. One of the most well-known is growth hormone deficiency. Growth hormone, produced by the pituitary gland, is like a conductor orchestrating the body's growth symphony. When there isn't enough growth hormone, the music of growth slows down, leading to short stature in children. Another common type is hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormone. Thyroid hormone is like the fuel that keeps the body's engine running, including its growth engine. Without enough thyroid hormone, growth can be stunted. Other types of growth disorders include Turner syndrome, a genetic condition affecting females, and achondroplasia, a genetic bone disorder that causes dwarfism. Each of these disorders presents unique challenges, but they all share the common thread of disrupting the normal growth process in children. Identifying growth disorders early is like noticing a small leak in a pipe before it becomes a flood. Early detection can make a world of difference in a child's life. So, what are the warning signs that parents should look out for? One of the most obvious signs is a child being significantly shorter than their peers. If a child is consistently below the 5th percentile for height on growth charts, it's a red flag that shouldn't be ignored. Another sign is a slow or stagnant growth rate. Children should be growing at a steady pace, especially during their first few years of life. If a child's growth suddenly slows down or plateaus, it could indicate an underlying growth disorder. Other symptoms can include delayed puberty, a chubby body build, and slow tooth development. It's important to remember that these symptoms can also be caused by other factors, so it's crucial to consult with a healthcare professional for a proper diagnosis. Think of a child's growth as a complex puzzle, with each piece representing a different factor that contributes to their overall development. When one or more of these pieces are missing or misplaced, it can disrupt the entire picture, leading to a growth disorder. Genetics play a significant role in a child's growth potential. Just like we inherit our eye color and hair texture from our parents, we also inherit our genetic blueprint for growth. Sometimes mutations in certain genes can disrupt this blueprint, leading to growth disorders like Turner syndrome or achondroplasia. Hormones act as chemical messengers, regulating various bodily functions, including growth. An imbalance in these messengers, such as a deficiency in growth hormone or thyroid hormone, can significantly impact a child's growth trajectory. Other factors that can contribute to growth disorders include chronic illnesses, malnutrition, and certain medications. Understanding the underlying cause of a growth disorder is like finding the missing piece of the puzzle, paving the way for targeted treatment and management. Section 5. Diagnosis. The first step towards treatment. Diagnosing a growth disorder is like a detective mission, gathering clues to solve the mystery. It starts with a thorough medical history and physical examination. The doctor will ask about the child's growth and family history. Measurements of height, weight, and head circumference are taken. A bone age X-ray may be ordered to assess skeletal maturity. Blood tests identify hormonal imbalances or other conditions. This complex process is crucial for providing the right treatment and support. Section 6. Seeking help. Treatment options for growth disorders. Once a growth disorder has been diagnosed, it's like having a roadmap to guide the child towards reaching their full growth potential. The specific treatment plan will depend on the underlying cause of the disorder, the child's age, and overall health. For children with growth hormone deficiency, growth hormone therapy is like providing a booster shot to their growth system. This therapy involves regular injections of synthetic growth hormone, helping them catch up on their growth spurt. In cases of hypothyroidism, thyroid hormone replacement therapy is like replenishing the fuel that the body needs to function properly, including growing at a healthy rate. This therapy involves taking daily medication to supplement the body's low thyroid hormone levels. Other treatment options may include surgery to correct bone abnormalities or address other underlying medical conditions that are hindering growth. The journey of treating a growth disorder requires patience, dedication, and a strong support system, but the rewards of seeing a child grow and thrive make it all worthwhile. Section 7. The role of nutrition in growth and development. Just like a plant needs sunlight and water to flourish, a child needs proper nutrition to support their growth and development. A balanced and nutritious diet is like providing the building blocks for a strong and healthy body. Protein, found in foods like meat, poultry, fish, beans, and lentils, provides the amino acids essential for building and repairing tissues. Calcium, found in dairy products, leafy green vegetables, and fortified foods, is crucial for strong bones and teeth. Vitamin D, obtained through sunlight exposure and certain foods like fatty fish and eggs, helps the body absorb calcium effectively. Iron, found in red meat, spinach, and fortified cereals, is vital for carrying oxygen throughout the body, supporting growth and development. Ensuring that a child receives a well-rounded diet rich in these essential nutrients is like providing them with the tools they need to build a strong foundation for growth. Section 8. Supporting your child's emotional well-being. Living with a growth disorder can be like navigating a roller coaster of emotions for both the child and their family. Children with growth disorders may face challenges such as feeling different from their peers, experiencing teasing or bullying, and struggling with self-esteem. It's essential for parents to provide unwavering emotional support, creating a safe and loving environment where the child feels comfortable expressing their feelings. Open and honest communication is key. Encourage your child to talk about their experiences, listen attentively to their concerns, and validate their emotions. Reassure them that they are not alone in this journey and that you are there to support them every step of the way. Positive affirmations and words of encouragement can go a long way in boosting their self-confidence and helping them develop a positive body image. Section 9. Living with growth disorders. Tips for parents. Parenting a child with a growth disorder can be like navigating uncharted territory, filled with unique challenges and triumphs. It's important for parents to arm themselves with knowledge, support, and a positive outlook. Educate yourself about your child's specific growth disorder, understanding the causes, treatment options, and potential challenges. This knowledge will empower you to advocate for your child's needs and make informed decisions about their care. Connect with other families who are going through similar experiences. Support groups and online communities can provide a sense of belonging, shared understanding, and valuable resources. Celebrate your child's uniqueness and focus on their strengths and abilities. Encourage them to pursue their passions, develop their talents, and embrace all aspects of who they are. Remember that your child's growth disorder is just one part of who they are. With love, support, and a positive attitude, you can help them navigate the challenges and live a fulfilling life. Section 10. Research and advancements in growth disorders. The field of growth disorders is constantly evolving, with researchers and clinicians working tirelessly to unlock new discoveries and improve treatment options for children. Like explorers charting a new frontier, these advancements offer hope for a brighter future for children with growth disorders. One area of research focuses on developing new and improved therapies for growth hormone deficiency. Scientists are exploring novel ways to deliver growth hormone, such as long-acting formulations that require fewer injections, improving the quality of life for children undergoing treatment. Gene therapy holds immense promise for treating certain genetic growth disorders. This revolutionary approach involves replacing or inactivating faulty genes that are responsible for the disorder, potentially offering a cure for conditions that were once considered untreatable. As research progresses, we can expect to see even more groundbreaking advancements in the diagnosis, treatment, and management of growth disorders, paving the way for a future where all children have the opportunity to reach their full growth potential. Section 11. A hopeful future: early intervention and support. The journey of understanding and managing growth disorders is an ongoing one, filled with challenges, triumphs, and a shared commitment to helping children thrive. Early intervention is like planting a seed in fertile ground, providing children with the best possible start in life. By identifying growth disorders early and implementing appropriate interventions, we can empower children to reach their full growth potential and live healthy, fulfilling lives. Support is like the sunshine and water that nourish that seed, helping it grow strong and tall. With the unwavering support of families, healthcare providers, educators, and communities, children with growth disorders can overcome obstacles, embrace their uniqueness, and achieve their dreams. As we continue to unravel the complexities of growth disorders, we move closer to a future where every child has the opportunity to stand tall and reach for the stars.